Guillain-Barré Syndrome, GBS, is a rare but serious autoimmune neurological disorder where the body's immune system mistakenly attacks part of the peripheral nervous system. Named after French physicians Georges Guillain and Jean-Alexandre Barré, who first described it in 1916, GBS affects people of all ages, but it is more common in adults and slightly more in males than females. The condition can lead to muscle weakness, paralysis, and even life-threatening complications if not promptly treated. Causes and triggers. The exact cause of Guillain-Barré syndrome remains unknown, but in most cases, it is preceded by an infection. About 2/3 of patients report symptoms of an infection, such as respiratory illness or gastrointestinal infection, several weeks before the onset of GBS. One of the most common bacterial triggers is Campylobacter jejuni, often contracted through undercooked poultry or contaminated water. Viral infections such as Epstein-Barr virus, EBV, cytomegalovirus, CMV, Zika virus, and, in some cases, COVID-19, have also been associated with GBS. In rare cases, GBS may follow surgery, vaccination, or other medical procedures. However, these associations are uncommon, and the benefits of vaccination overwhelmingly outweigh the risks of GBS. Pathophysiology. GBS is classified as an autoimmune disorder. Normally, the immune system protects the body against pathogens. In GBS, the immune system mistakenly targets the peripheral nerves, particularly the myelin sheath, a protective covering of the nerves, or the axons themselves. This damage interrupts the normal transmission of nerve signals, leading to muscle weakness, numbness, and in severe cases, paralysis. There are several subtypes of GBS, the most common being acute inflammatory demyelinating polyneuropathy, AIDP, the most prevalent form in North America and Europe. It involves demyelination of peripheral nerves. Acute motor axonal neuropathy, AMN, more common in Asia and Central America, primarily affects motor nerve axons. Acute motor sensory axonal neuropathy, AMSN, a severe variant that affects both motor and sensory axons. Miller-Fisher syndrome, MFS, a rare variant involving eye muscle paralysis, coordination problems, and areflexia, absence of reflexes. Symptoms and progression. GBS typically begins with tingling sensations or numbness in the feet and legs, which may spread to the upper body and arms. This is followed by muscle weakness that can rapidly progress. Symptoms may worsen over hours or days and usually peak within 4 weeks. Common signs include tingling or pins and needles sensations in the extremities, weakness in the legs that spreads to the upper body, difficulty walking or climbing stairs, loss of reflexes, pain, especially in the lower back, difficulty with facial movements, including speaking, chewing, or swallowing, difficulty breathing, in severe cases, heart rate or blood pressure fluctuations. In about 20 to 30% of cases, GBS can progress to respiratory muscle paralysis, requiring mechanical ventilation. Autonomic dysfunction can also lead to irregular heart rhythms or blood pressure instability. Diagnosis. Diagnosis is based on clinical symptoms and supportive tests. Since GBS progresses quickly, early diagnosis is critical. Key diagnostic tools include lumbar puncture, spinal tap. Elevated protein levels in cerebrospinal fluid without a significant increase in white blood cells is characteristic of GBS. Electromyography, EMG, and nerve conduction studies, NCS. These assess the electrical activity of muscles and nerves to detect nerve damage or demyelination. Blood tests and imaging, used to rule out other conditions. Treatment. While there is no cure for GBS, early intervention can significantly reduce the severity and duration of symptoms. The two primary treatments are intravenous immunoglobulin, IVIG, a standard treatment where healthy antibodies are infused to block the damaging antibodies. Plasmapheresis, plasma exchange, a procedure that filters the patient's blood to remove harmful antibodies. Both treatments are equally effective but are not used together. Supportive care, including physical therapy, respiratory support, pain management, and monitoring of heart rate and blood pressure, is essential for recovery. Prognosis and recovery. The majority of individuals with GBS recover fully, although the timeline varies. Some patients begin to improve within days of treatment, while others may take weeks or months. About 80% of patients walk independently within 6 months, and 60% fully recover motor strength within a year. However, 5 to 10% of patients may have permanent residual weakness, and about 3 to 7% may die from complications such as respiratory failure or infection. Relapses are rare but can occur in about 3% of cases. Living with GBS. Rehabilitation plays a crucial role in helping patients regain strength and independence. Physical therapy, occupational therapy, and psychological support can significantly improve long-term outcomes. Many patients deal with fatigue, pain, or minor sensory problems long after the major symptoms have resolved. Support groups and counseling are also beneficial for coping with the emotional and physical challenges of the illness. Conclusion. Guillain-Barré syndrome is a rare but serious condition that demands immediate medical attention. With timely diagnosis and appropriate treatment, most individuals recover well, though the journey can be physically and emotionally taxing. Continued research and awareness are essential for improving outcomes and understanding the complex nature of this autoimmune disorder.